Hi, this is Dr. Paul, and thanks for tuning into this video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about a root canal treatment. Now, the technical terminology for this is an endodontic treatment. Let's break it down. What is a root canal? A tooth consists of three surfaces. The first is enamel, which is the exterior surface. Enamel is all mineral and there is no nerves inside enamel. This is basically why if you have a baby cavity starting out, you will never feel pain because it's in a zone that has no nerve endings. The second is dentine. Dentine has sensation because it does have a few nerves, but that's usually in the second layer of dentine. The first layer or the first half of dentine has no nerves, and that's why when a cavity or decay starts from the enamel and goes down half the width of dentine, you still won't feel anything. When decay is within the second layer of dentine, that's when you start getting sensitivity to cold and sweet. And what's underneath or inside the whole tooth is a chamber called the pulp chamber, which consists of live nerves, blood supply, which is an arteriole and a veniole, and that basically means blood that comes in into the tooth, and there are chambers that take the blood out from the tooth. Now, when you have decay that spreads from enamel to dentine and eventually it touches the nerve or the pulp chamber of a tooth, you now have a live contamination of bacteria that have a ground to fester within the tooth structure itself. When this occurs, there's really no way for the tooth to heal itself unless a dentist gets in there and does what's called a root canal treatment. As much as we'd like to draw diagrams where a tooth has two roots and four canals, or sometimes even up to five canals, there are a lot of lateral canals or extra canals within the tooth that exists which we just can't see. What we are hoping for is whatever we do in terms of a root canal treatment would heal most of the areas where there's a live infection, and when we put a bio-inert filling inside, it should hopefully plug all these areas up, and you're kind of hoping, just like a mummy, to entomb the bacteria within this enclosure and call it a day. For some people it works, for some people not so much. When a root canal is done well with a general practitioner like myself, or even with a root canal specialist, there's really no guarantees that you will never have a reinfection of a root canal system or a root canal treatment, and this is basically because it depends on a bunch of factors. From the virulence of the bacteria to the number of lateral canals that were missed, to even if an entire canal which wasn't or could not be identified within the tooth was just left without cleaning within it. Now, let's talk about why a tooth canal or a tooth infection hurts so much. Whenever you have any kind of trauma to any part of your body, your skin has give. So you will have a swelling wherein everything is tender and inflamed. Stuff feels warm around that area, but with time everything settles down and you're okay. The nerve inside the tooth is in a hard shell, which is basically the tooth itself. So whenever you have decay or any kind of trauma from an accident where there's a nerve exposure, the nerve tries to swell up, but unfortunately it has no place to go. So in a sense, when you think about it, you have a live nerve which is trying to expand, and it's kind of strangulating itself, and this is why a toothache is so extreme and excruciating. This is also the reason why, if you don't take care of your teeth with changing old leaky fillings in time, or if you have some kind of fractures where there is dentine exposed or even the nerve exposed, and if you prolong treatment, eventually you will end up needing expensive and even painful root canal treatments. I hope this has shed some light into the whole fact that root canal treatment is not always 100%, and there's always areas or always zones where for some people it works 100%, but for some people not so much. This is also another important reason why we should try to avoid this entire root canal requirement by changing fillings that are leaking, or even changing big fillings that have the potential to leak or fracture to crowns. It's all about trying to save your teeth to prevent root canal treatments and eventually extractions by being very, very proactive in our approach. If you have any questions or concerns, or if you think that you have a root canal treated tooth that's all of a sudden becoming painful, just give us a call and maybe we can help you. Thank you so much for watching this video, and hopefully it has shed some light into this entire situation. Thank you.